Hi, I'm Dr. Griffin, and this is my daughter Maureen, and we're the Griffin Hair Restoration team.
Tonight, we're going to be reviewing a few different ways that you can both restore and preserve your hair. The first one is going to be PRP, or platelet-rich plasma. PRP is serum that is derived from your own blood and is highly concentrated with platelets. Platelets contain a very large number of growth factors, which will ultimately help to restore your hair by producing more follicular hair cells. When you come in for your PRP treatment, I will first draw your blood and get it into our centrifuge, which will separate out the platelets. While the centrifuge is working, I will numb the scalp with a local anesthetic, similar to what a dentist may use. I will then do some microneedling on the scalp, which will help to activate the platelets. Platelets are activated by injury, for a lack of a better word. So by causing those tiny little pinpricks to the very surface of the skin, we're telling the platelets, once they're injected, that they need to go to work and start repairing that injury, whereby they end up reproducing follicular hair cells at a much faster rate than if we didn't do the microneedling. Once the scalp is prepped, the centrifuge is done separating out the platelets. We mix the platelets with something called A-cell. A-cell is a protein binder that tells the platelets to seek out and stick to the hair follicle specifically, so that when the platelets recognize that injury from the microneedling and start to reproduce cells, we know that it's reproducing follicular hair cells and not other cells in the surrounding area. Once the platelets are mixed with the A-cell, we inject them throughout the scalp, concentrating on the areas that are most thin. I then give the scalp a massage, and you can put a hat on and go about your day. I've included a few before and after photos of patients who have undergone the PRP treatments. For the initial PRP booster, we typically do a set of 4 PRP treatments spaced about 8 to 10 weeks apart. After the first treatment, I usually see less shedding and occasionally more shine and volume to the hair. When you come in for your third treatment, that's when I usually see the first boost in density, and from there it continues to improve. Next, my dad is going to discuss the follicular unit, or FUE, hair transplant procedure.
Today we're going to explain the procedure of hair transplantation. Basically, hair transplantation involves harvesting follicles from what we call a DHT resistant area or safe zone in the back and sides of the head and transplanting them to the areas where the hair is thin. So in this video, we're going to take you through the procedure, starting with the harvesting, which is being done by my daughter Maureen using a very small punch device, which is harvesting individual hair follicles, or in some cases what are called follicular units, which may include more than one hair. Once she is finished harvesting, those hairs will be placed in a solution which preserves them until they're implanted into the area where we intend to place those follicles. We also draw some of your blood for PRP. So PRP, or platelet-rich plasma, is helpful for producing hair growth or encouraging hair growth. It also encourages wound healing and helps the follicles to take and grow more quickly. Once the follicles are sorted and ready for implantation, they're stored in a solution which contains a cold saline solution plus some of your own PRP, which is a helpful preservative until they're ready to be implanted. So at this stage of the procedure, I'm deciding where exactly we're going to place the hairline. And this is really where the art of hair transplantation comes in. What we want to do is place a hairline that's going to look natural, not only today, but as the patient ages. So we don't try to recreate a juvenile hairline, which is oftentimes very low on the forehead. We're trying to create and place this hairline in an area that's very natural for a patient's age. And this is really the anterior or lowest point of the hairline. All the grafts that we place will be above this line and behind it. In this patient, we've taken close to 3,000 grafts because he has a diffuse pattern of hair loss. And what we'll be doing is rebuilding the forelock zone, which is the frontal half of his head and his hairline, with this transplant procedure. Once I create the hairline and the patient agrees on its location, we'll start local anesthesia to numb what's called the recipient area where the grafts are going to be placed. Once the anesthesia takes hold, we're then going to make what are called sites. We're going to use a small blade to make little incisions throughout the recipient zone. In this case, we need to make about 3,000 incisions, starting along the front and extending all the way back to the middle of the scalp. Once the incisions are made, then we have a team of specialized technicians whose main job is to place the follicles in each of these sites that is made. Once the sites are made, the PRP that we've previously harvested is injected prior to implantation. And then finally, a needle-nosed forceps or jeweler's forceps is used to place the follicles until all the grafts which are harvested are placed. These grafts will heal, and in 3 to 4 months' time will begin to grow. You can see the donor area has little tiny holes, which in one day, this is one day after the procedure, have for the most part closed already, and they'll continue to improve over the course of a week, such that after a week, those donor areas will be completely healed. The grafts will form scabs over the first week after the procedure, after which the hairs will start to grow in about 3 or 4 months. It takes 6 to 9 to 12 months for the full result of the transplant to be fully realized. And once that hair grows, it'll be permanent because it's coming from a safe area which is DHT resistant, and those follicles will always be present for this patient.
The FUE hair transplant is a procedure that is very well tolerated by patients with little to no pain as early as the very next day. The morning after your procedure, you will come into the office and see me, and I will get you cleaned up and then clean and check the grafts in the recipient area. I also go over a calendar with the Aftercare for the week that makes everything extremely simple and easy to do and manage on your own. We also try to think of ways that help our patients disguise the procedure for the week after their procedure. So we not only have a hairstylist do the haircut prior to the procedure, we also provide a hat that helps to conceal the donor area and cover the recipient area, so you can go about your day normally. So this patient just had his hair transplant recently, so we do not have his after photos yet. However, please enjoy a few of our previous before and afters.